It's my pleasure to again welcome you to the Gordon J. Christensen Career Development Program. We're on a topic today that you cannot avoid, and it's a topic that many dentists know not a lot about. Bruxism has been observed throughout the history of mankind. The word bruxism is derived from a Greek word, which means gnashing of teeth. You've even seen that in the Bible. As would be expected, dentists are very concerned about this repetitive grinding and or clenching of teeth. Because bruxing patients rapidly destroy any restorative treatment that dentists can possibly place in their mouths. In dental school, I don't have to tell you, dentists have minimal preparation on how to treat these patients. Yet they can't avoid encountering the problems related to bruxism immediately after dental school. Additionally, there have not been significant advancements in measuring the severity, the duration, the causes, and the most appropriate treatment for bruxing patients. There are different types of bruxism you may or may not know. Dentists should be knowledgeable about these differences. These different modes of bruxism significantly influence the type of restorative treatment that is appropriate. As a prosthodontist, I've seen that again and again and again. Different types of bruxism. I have to treat them very differently. As is obvious in this image, these two types of bruxism are very different, and we will differentiate them in this presentation. Now you're in for a treat. May I introduce you to Jeff Weiscarver, who is a registered sleep technician. What does that have to do with this? You're going to find out. And it's very interrelated. Jeff, tell us about bruxism.
Thank you, Gordon. Although there are other sleep devices on the market, the DDME Bruxism sleep monitor specializes in measuring bruxism. And the device is quite simple to use, and it has a number of channels that are unique in that they measure the jaw EMG, and then we have software algorithms that run on those channels and produce reports that we'll talk about in just a second. To capture the measurement, you simply give instructions to the patient to take the device home, and they go through a 4-step hookup process, and essentially that involves attaching the device to their chest, putting a sensor on their cheek EMG area, putting a couple other sensors on, and going to bed in the comfort of their own home. In the morning, they return the device to your office, and a report is generated. And this report gives detailed information on the frequency, strength, and type of bruxism and enables the dentist to distinguish between grinding and clenching. In this report, we have a patient that has bruxism that would fall into the moderate to severe category because their bruxism index is 22.5 per hour. And in the literature, 4 per hour with 2 malocclusions is considered abnormal. This is Kristen. And Kristen had a complaint of bruxism and snoring, so she was nice enough to undergo a home sleep test with the bruxism monitor. And as a result of that test, we learned that Kristen had a bruxism index of 22 per hour, which is quite high. We confirmed that she snores, and we also, and quite surprisingly, learned that there was a mild amount of sleep apnea in certain sleep positions. This is Kristen's report. And you can see by the numbers that she had significant amounts of both tonic and phasic events, which is clenching and grinding. And then you can also see that she had some apnea, and she snored 7.5% of the time. This is a sample of Kristen's data. And in your office, when you would review this type of data, this is the type of information that you would use to make a decision. And in this case, you can see clearly that she's snoring based on the bottom channel there. And then there is also a very strong clench. And this is a clench because it's a short, strong event and very little back and forth movement. And then we also actually caught some audio of the clench on this particular event. So what we did as a result of the outcome of her study, which is the same type of decision you would make in your office, is we fit Kristen with a night guard. And she decided and was very kind to repeat the sleep study in her home, and we reran the numbers, and this is the outcome. Her sleep was completely normalized. Her bruxism index is well within normal limits. Her apnea was managed, and she even slept on her back on this test. And her snore index went from 7.5 to below 2, which is a great outcome.
Kristen, we appreciate you having participated in this little exercise because I think it will help all of you who are viewing. Let's retrace what's happened. She's in your office. You see signs or symptoms of bruxism, and you elect to purchase a device that Jeff's already talked about that will allow you to monitor her bruxism and clenching. And Kristen wears it. She wore it how many nights?
3 nights.
Now, the data is interpreted by you. You don't have to send it anywhere. It's interpreted by you as Jeff just identified it for you. And it's found that she has very minimal sleep apnea. Jeff, what if she had more severe sleep apnea? How many episodes per night?
The range is any apnea is greater than 5 per hour is considered a medical issue and should be managed by a board-certified sleep physician, or alternatively sent to DDME, and we'll manage the medical aspects of the diagnostic process.
So there are 2 ways. So it's you, it's in your office, you've interpreted it, and you found, wow, there's a lot of bruxism and clenching going on there. And you've decided now, perhaps we better make that less active by doing exactly what Kristen has done and Jeff has talked about. Kristen, how difficult was it to wear the device, the monitor?
It wasn't hard at all.
And how did you learn how to do it?
There's a little card that comes in the device, and there's pictures, and it's very self-explanatory.
And your staff could demonstrate that to her before she took the device home with them. We're basically going to look at the concept of splints. There are many different types of occlusal splints about which you may already have significant knowledge and with which you may have some experience. There's some things you and I probably didn't know till I prepared for this video and you heard it, and that is you may foul up parts of sleep with an occlusal splint. We're going into that in just a minute. However, this presentation has a different perspective and may make you think more about the need for splints and how to use them. May I stimulate you to think about our previous discussion in this presentation relative to nocturnal and daytime bruxing. Does your obviously bruxing patient require a splint or not? Jeff, tell us how you feel about that.
Thank you, Gordon. Besides protecting the teeth, are we having any other impact on the patient when they're wearing a splint? Are they exerting excessive force through the splint? Changing the airway by putting in a splint. When you place a splint in, does it displace the tongue back into the airway? Is keeping the teeth apart enough? By distributing the clenching and grinding forces across the vertical space, is this really protecting the teeth? Maybe. By measuring the patient through the restorative process, you'll know.
Thank you, Jeff. It's interesting to me that none of us has really been measuring the amount of bruxism. And that's been a real frustration to me as I have learned more and more and more about how to measure it. Let's measure it. There are now methods to measure the duration and intensity of bruxism and differentiate it into grinding and clenching. As Jeff showed you, take good attention to that and look seriously at that device.